Hi, my name is Shelley Haupt. The thesis of my speech today is that everyone should consider a DNR. Do you want to be resuscitated if your heart stops beating or if you stop breathing? It's a common question that's asked on ambulances every day, yet the answer that we receive is a look of shock. So who wants to plan their death today? Or better yet, who wants to leave their family not only with the grief of losing them, but having to make decisions on your medical treatment without knowing what your wishes are? Today I plan on giving you some information to help you decide whether a DNR works for you. First, a DNR is a legal document of your wishes. Second, CPR is not a cure. And third, death is a fact of life that needs to be planned. So for my first point, a DNR is a legal document of your wishes. Mark Porman, who is a medical malpractice attorney, wrote an article in the American Journal that described DNR, which is Do Not Resuscitate Order, as a legal document that an individual carries on their person that instructs healthcare providers to withhold CPR. It is not a do not treat or a refusal of treatment. It is simply a refusal of a specific treatment, CPR. Everyone knows that it is important to plan life events with your family. Death should be as equally important. It eases the stress and suffering of your family members to plan your death before it actually occurs, so they know what your wishes are when CPR needs to be completed. So now that I've explained that a DNR is a legal document that describes your wishes, let's move on to CPR. CPR is not a cure. Watch any medical drama, and you will see unrealistic depiction of CPR. You will see a gentleman brought into a room who's had a heart attack. They do CPR on him. He instantly wakes up, and he's magically cured. Leaves the hospital later that day without any long-term effects. Well, I hate to be the bearer of bad news, but CPR is not a cure. AHA, which is the American Heart Association, they are the leading experts regarding CPR. Describe CPR where the chest cavity is compressed hard and deep enough to pump the blood out of the heart. Most often CPR is done 2 inches. So the person that's doing CPR on you is literally pushing your chest 2 inches deep to get your heart to get rid of the blood. The AHA admits, even with the most successful CPR, CPR has only a 6% survival rate, and that's only if it's done in the first 5 minutes. 96% of the people that survive of that 6% have long-term deficiencies. CPR is not a cure. It simply sustains life until they can try to fix or treat what actually caused the heart attack. Everyone that has CPR done on them experiences broken ribs, as well as bruised organs. So now that you understand that CPR is not a cure, let's move on to death. Death is a fact of life that needs to be planned. I remember the first code that I had as a medic. I was scared senseless. I remember wide-eyed and scared watching this patient, and the older medic that I was with, who was actually my mentor, looked over and smiled at me because I think he could read my thoughts of, is this really what I want to do every day for the rest of my life? And he smiled, and he said the same statement that I've said to myself in every code that I've had since. That we don't cure people, and we don't save people. We simply entertain people until God makes the decision as to whether or not that person is going to live or die. Death, unfortunately, is a fact of life that most people don't look at unless it's at their door. In my line of work, we look at it every day. The World Health Organization names the top 2 causes of death worldwide of cardiovascular disease and heart attacks. CPR is basically designed for that. Brittany Hargrove wrote in the USA Today that the average heart attack for a male, his age is 66. For a female, it's 70. I've worked on patients that have had a heart attack on the first day of their life. and 100 years old. It can happen to anybody at any time. Death, unfortunately, is a fact of life that needs to be planned. So today, I kind of rained on your parade of ignorance is bliss by talking about a moment that we all are going to have to face at one time or another. I hope that it makes you talk to your loved ones. I hope it persuades you to think about whether a DNR is right for you, whether you want CPR completed on you. Everyone should consider a DNR. A DNR is a legal document. CPR is not a cure. And death is a fact of life that needs to be planned. I see more death in my occupation than I care to. But what it does make me realize is that life is very fragile, and you never know when an emergency is going to come your way. And in case you are curious, I have considered a DNR. And even though the chances of my survival are minute, and I probably will have some deficiencies after CPR is performed, to have one more day to spend with my family for me is worth it. My name is Shelley Haupt. The thesis of my speech is that a DNR should be considered. And thank you for listening. I got to show the cards, so let me do that. So,
Well, Mama, can I
1, 2, 3, 4, 5. Thank you.